Good afternoon, everybody, and welcome. Thank you for joining us on this Wednesday afternoon. I know folks will continue to trickle in, but I'm going to go ahead and get started. Let me just pull up my notes. Okay. Great. So welcome, everybody. This is session number 3 of 5 for our Take Care, Demystifying Insurance and Care Options for Independent Arts and Culture Workers series. This is our third session. It is called Navigating the Mental Health Landscape as an Artist. I'm very, very excited to bring this session to you all today. My name is Kinsey Keck. I use she, her pronouns. I'm the programs director here at the New York City Arts and Education Roundtable. I'm a white woman with brown hair. It's pulled back in a ponytail today. And I'm wearing some large round wire-framed glasses and a cozy, very bright red hoodie. And I'm sitting in front of a window with some white curtains. And as I said, I'm the programs director as well at the Roundtable. For those of you who don't know, the Roundtable is a grassroots service organization that works to improve and advance the state of arts education here in New York City, New York State, and beyond. Although we are currently meeting online via Zoom, the Roundtable would like to acknowledge that we do work and live on unceded lands. Mannahatta, or the place that we also know as New York City, exists on the contemporary and ancestral homelands of the Canarsie, Munsee Lenape, and Wappinger people. These sovereign nations and communities are still thriving here, and we continue to occupy their lands. We would like to give a moment of respect to them, as well as to the Black and immigrant communities which have helped build the city that we know today. As we recognize that all of our pasts, presents, and futures are intertwined, I'm just going to share again a number of contemporary Indigenous arts organizations that we can all hopefully support and learn from. So I'm just going to paste those links in the chat. I encourage you to save them. Check out these organizations if you have the time. If you can support them with donations, please do. I also invite you to do some research in your own area if you're not in the same area as we are. And please feel free to share any links or resources in the chat that you would like to share with folks on the call. Thank you. Just a few quick reminders. If you're having trouble with Zoom, message me, Kinsey. I'm here to support. Please do keep your mic on mute unless you're the person speaking so we can all hear each other clearly. Please use the chat to connect with folks on the call, but also to share your questions. I will be saving those and we will have time for Q&A throughout the call and at the end as well. This call does include closed captioning, so you can activate your captions on your menu. You'll find a button that either says live transcript or show subtitle, depending on the version of Zoom you're using. It may also be under those 3 buttons, that more section. You can click that and click show subtitles, and you'll have access to those. And lastly, this session is being recorded, just like all the other Take Care sessions in this series. They will be sent to registrants in a follow-up email in the weeks following the conclusion of the series, which ends on Friday. So you'll have a follow-up email from me with all of those recordings and any resources, slide decks, all that good stuff from these sessions. And that is it for me. Thanks for listening to my spiel. And now it's my sincere pleasure to introduce our facilitator for today. Please join me in welcoming Dr. Alana Mendelsohn. Dr. Mendelsohn is a Harvard and Columbia educated psychiatrist and neurobiologist, a research fellow at Columbia, and the founder of Creatives Care, which we're going to learn much more about today. So welcome, Alana. Thank you so much for being here. I turn it over to you.
Thank you. Thank you so much for having me. Since it's a small enough group, I was wondering would it be possible to maybe do some quick intros? I'd love to hear about you guys, really just about your artistic backgrounds, and it would make it easier, especially if we have a discussion or Q&A later, just to make it as tailored as possible. You're just welcome to unmute yourself, just say hi, what you do professionally and creatively. It'd be wonderful to know.
I'll go first. Can you hear me?
Yeah, absolutely.
Hi, my name's Alberto Dennis. I'm a teaching artist with the New Victory Theater, and I work as a working actor, dancer, choreographer, and designer of immersive theater, and as a teaching artist for the New Victory. Yeah.
Hi, I'm Alexis Atkinson. I'm a teaching artist for Carnegie Hall, specifically songwriting and in criminal justice spaces. And as an artist, I am a musician, I'm an actor, I'm a writer, both play and screen, and a director of film.
Anyone else who wants to introduce themselves? Otherwise, we can move on. Oh, I see someone in the chat. Oh, super awesome. Wonderful. Thank you. If anyone can...
Sure. What's going on, everybody? My name is Askia Muhammad, an actor, teaching artist for the New Victory and Lincoln Center Theater.
Awesome. Okay, moving on, and if anyone else like at any point wants to jump in, if you have questions, comments, concerns, this is meant to be fully interactive. You have a full right to also disagree with anything that I'm saying here. If you disagree with me, let's talk about it. Mental health is a very relevant and important topic, and just because I have a fancy medical degree doesn't mean I'm an authority. Everyone is an expert on their own mind. And so I think that these conversations best work as an open discussion. So before we get started, we actually made a little poll we wanted to run by you guys, completely anonymous, but I thought it would be a nice sort of prompt before we get started to talking about mental health and why it can unfortunately be difficult to navigate. Okay, so I think almost everyone's responded. Basically what this question was asking is, have you sought mental health treatment? And if so, have you had trouble finding it? And unsurprisingly, the vast majority of you, and also frankly, everyone, especially artists in New York who have tried to find mental health treatment, have run into some sort of challenges with it. And I don't want to ask anyone to put themselves on the spot of talking about their own personal experience, especially if they're not comfortable with it. But what we're going to do in this presentation is go through at least some of the common reasons that people run into trouble finding mental health treatment or finding the right mental health treatment, and talk about some of the things that may be able to be helpful if you do choose to seek mental health treatment at some point. So let me get started with this presentation. And just to very briefly introduce myself. So I'm a psychiatrist. I have a small private practice. I work with mostly young adults. Many are artists themselves in both medication management and psychotherapy, but I have a longstanding interest in the arts. I studied classical violin for many years. I'm a big theater and opera nerd and music nerd. So the topic of mental health in the arts is something that's been very important to me for some time. So why does mental health matter in the arts? So we're going to talk about a number of topics today. Just want to run through the agenda. So why does mental health matter for artists? We're going to talk about navigating the treatment landscape. Why would one seek mental health treatment? What are the types of mental health healthcare providers that are out there? How do you choose a provider? How do you navigate insurance? And then I'm going to talk a bit about this organization called Creatives Care that I co-founded that helps artists in New York City access high quality and affordable mental health care. And then hopefully we'll have some time at the end also for questions and discussion. And please feel free to interrupt at any point. So why does mental health matter in the arts? So many of you guys have probably encountered this myth of the tortured artist. This is that you have to be mentally unwell or unstable to make great art. And in the classical music world, we've got folks like Robert Schumann, who is a famous composer who died in an institution. In the popular music side, a lot of us have been familiar with popular artists like Britney Spears or Kanye West, who have either intentionally or not been topics of discussion about mental health and creative output. It's my personal view as a provider and the philosophy of this organization that we started that the whole idea of a tortured artist is a myth. In my experience working with artists, being unwell is not helpful for productivity. Having a range of human emotions, whether it's sadness or grief or loss, can absolutely inform the creative work that artists do. but not being functional because of anxiety or depression or trauma is not going to help you make your best art and make your best art productively. The other reason mental health matters in the arts is that we believe that mental health care is part of healthcare. This should not surprise anybody, but it's been extensively shown that there is a very close link between physical health and mental health. When you are not well mentally, you are more likely to get sick physically. When you are sick physically, it's going to have an impact on your mental health. And as we were saying, being well is really important for being creative and productive. Another thing is that being in mental health treatment is not just about wellness, like, treating symptoms of getting better from the perspective of anxiety or depression, but it's my personal experience working with artists and that being in therapy can really be important for also fostering personal and creative growth. When I have patients who are therapists, patients who are artists, we will talk often quite explicitly about what they're doing in their creative work, whether it's painting or preparing for a particular performance. And being able to link that to their mental health history, their personal history, their family, their relationships, their identity can be really important. And I believe that when people feel well and safe and in a trusting therapeutic relationship, that's a really important step that can help artists to take on more ambitious and potentially challenging creative work. And the other thing is that well-being matters for inclusivity and diversity. I hope all of us would agree that the arts really benefits from having a diverse group of people creating art. And for folks, especially who come from more challenging or marginalized backgrounds, we want to hear those voices, and mental health can be really important for helping people to be able to continue to be making art despite whatever challenges that they're facing. So many artists struggle with mental health care. Struggle with mental health challenges. So this hasn't been studied extensively. There's one study that was done of classical musicians in England, and it was, showed that about 70% of the artists that they polled were struggling with issues like anxiety and panic, and up to a third were struggling with substance use. And I think for many of you guys who work in the arts in New York City, knowing your colleagues, you might say these numbers maybe are even higher. So needless to say, what we do believe is that artists are struggling with mental health challenges at a much higher rate than the general population. And this can be for many different reasons. So why are artists having a hard time accessing care? So there's a number of different challenges that artists face, which many of you guys unfortunately have probably encountered yourself. So a lot of artists don't necessarily get very good health insurance, if they get health insurance at all. Many artists are freelancers. They don't necessarily have a stable employer to be providing them with benefits. Or they're working in settings that are financially strapped that can't offer very high quality benefits. Artists often struggle with unstable sources of income where they don't know whether their paycheck is going to be coming next, or they may be earning income from many different sources. And then also artists struggle with, not necessarily struggle with, but have often non-traditional work hours. If you are working multiple jobs while auditioning, or you're on tour, that's a really challenging schedule to then try to fit in some regular form of healthcare. I actually spoke when we were getting this organization started. I spoke to a Broadway actor who was performing, like 6 or 7 shows a week, and he's working 6 or 7 days out of the week. He's like, I don't have time for therapy. I'm working all the time. There's also a lot of challenges on the provider side that make it hard to access care. So some of these are things you may have encountered. Many mental health providers don't accept insurance. This is called being out of network. The cost of treatment, especially in New York City, can be prohibitive for many folks. There are so many treatment options and different providers out there that it can be absolutely overwhelming to be able to decide on where to go. And then another thing is that a lot of artists have communicated to us that many providers don't understand the particular challenges that artists face, and that for artists, their creative work is often so tied to their identity that working with a provider that doesn't really understand them, not just on a personal level, but on a creative level, can be really alienating. So next, we're going to talk a little bit about how to navigate the mental health landscape. So the first thing is, why seek mental health care? And this can seem like a little bit maybe of a trivial question, because a lot of people already may have a sense of, well, why should one get help? But I want to break it down into a couple different categories that might be helpful, either if you or someone you know is thinking about getting into treatment. So the first reason why someone might seek mental health treatment is because they're having mental health symptoms. So this can be things like difficulties with their mood, either that they are depressed or having an unstable mood or volatile mood or irritability, issues with anxiety, attention and focus, motivation, substance use, disordered eating, difficulties with sleep, either insufficient sleep, insomnia, or excessive sleep. These are symptoms. These are things when someone is actually thinking about, well, this is something I actually need help with. I'd like it to get better. Some types of mental health symptoms are higher risk and potentially more dangerous. These are things like self-harm, suicidal thoughts or thinking, and also self-destructive behaviors that can get people into pretty serious financial trouble or even legal trouble. There's also things that are happening in our lives that can precipitate a desire to get additional support. Things like grief, relationship ruptures, professional setbacks, etc. So these are things that are happening in your life that may be things that you want to better understand or need some help with. A big topic for people seeking out mental health treatment is challenges with relationships and communication, whether it be finding that you're having a recurring pattern of forming certain types of relationships that are not proving to be satisfying or stable, or having trouble communicating in the relationships that you already have. This is one of the biggest reasons that people want to get into therapy. And then I would add that a last category, which is one that I think is underappreciated, is wanting to understand oneself better and to actualize your identity. And what I mean by that is to live in such a way that feels authentic to you. And this is especially important for artists who are often thinking about how they want to express themselves creatively and build an artistic career that feels authentic and meaningful to them. And this is obviously something that you as an artist are talking about with your fellow artists, but it's actually something that you can think about talking about in therapy as well, because of that individual focus. So where do people get mental health treatment? So one setting is what's called outpatient treatment. This is, for example, going to an office and seeing a mental health provider in a private setting. It can be seeing someone over telehealth, so having a session with a mental health provider over your computer. And it can also involve support groups, and we can talk a little bit about what support groups can involve. Another option are hotlines. So these are, you've probably seen on the subway advertisements for things like NYC Well. These are hotlines where, especially if you're in a crisis situation, you can reach out and get connected to someone who can help you work through that immediate crisis and get you connected to other forms of care. For people who are struggling with more serious or potentially high-risk symptoms, there are more intensive treatment options available, including day treatment programs where people are essentially completing multiple hours of treatment a day in a structured setting, or residential treatment where people are living in a mental health facility on a voluntary basis and receiving intensive treatment. And then when people are in a particular crisis and need to be in the hospital, that's called inpatient care. And the two settings where this happens are the emergency room, which is when someone is in an immediate crisis and they simply just need to be seen by somebody. that's a place where they get triaged to then, decide where they to go next. And then psychiatric hospitals or inpatient treatment units are places where people go for stabilization and evaluation and diagnostic clarification when someone is really not able to take care of themselves or is in a potentially dangerous situation. So I next want to talk about the types of mental health care. So you are probably familiar with psychotherapy. This is, talk therapy, where you are working with the provider and talking about particular issues and working through which, whatever mental health goals that you have. But part of mental health care also can involve involve medication as well. So medications can be helpful for people in a number of different situations. So a question people will often ask is, well, when should I think about whether medication is right for me? And this is a highly personal decision. And obviously it's going to vary person by person, but I just want to highlight a couple key categories of issues that might tip you into thinking that medication might be something to consider, or at the very least that you might want to be evaluated by somebody who prescribes medication to see if it might be helpful for you. So the first is severe or high risk symptoms. These are always the kinds of things that should tip you off that maybe therapy in and of itself is not going to be sufficiently helpful. If you're having difficulty functioning, that's a sign that medication may be helpful, especially if you are so unwell that you're really not able to even engage in therapy. And then the last thing to consider is if you are in therapy, but you find that your symptoms are not improving, that you're stagnating, or that you're spending so much time in therapy talking about the challenges that you have, that you're not really benefiting from the therapy, that's a sign that medication potentially can be helpful, not just for alleviating symptoms, but making it more likely that you can benefit from therapy. So there are many, many, many types of mental health providers out there, and this is really confusing, and it didn't used to be like this. In the last however many number of years, there's been an explosion of different mental health training programs, and it can be really confusing as a prospective patient to know what kind of provider should I be thinking about seeing. So I just want to talk through a couple of these just so that you're familiar with it. And the biggest difference between providers is how much training they've had, and then whether they prescribe medication or do therapy or do both. So a psychiatrist is a person who has a medical degree. They've completed 4 years of medical school in addition to a 4-year clinical training program that's called a residency. And psychiatrists are trained both to prescribe medication and do comprehensive diagnostic evaluations, and they also are trained to do psychotherapy. Outside of New York, for a variety of sort of financial and insurance reimbursement reasons, a lot of psychiatrists tend to focus more on medication management. But for whatever reason, culturally in New York City, largely due to the legacy of psychoanalysis, a lot of psychiatrists in New York City do therapy and are really excellent at it as well. Psychiatric nurses are nurses that have completed specialized training specifically in mental health. They also prescribe medications and do therapy, though they may not have as much therapy training as other types of providers. Clinical psychologists have a doctorate, either a PhD or a clinical doctorate called a PsyD. So they've completed extensive clinical training in their doctorate, as well as a clinical internship. And they are very well trained in therapy. Many of them have specialty training in particular modalities of therapy. And then licensed clinical social workers are LCSWs. These are master degree social workers who have additional supervised training in psychotherapy. Many of them are excellent, very well-trained psychotherapists who've completed specialty training in particular modalities. And then there's a number of different other master's degree providers, LMSWs, LMFTs, LMHCs, LCATs. These are folks who may not have as much psychotherapy training, but it really varies person by person. There are folks who have these degrees who are spectacular therapists with excellent training. And so it may just mean you want to kind of get a sense for each person, what their background is. I want to highlight the licensed creative arts therapists because they're a little bit different. These are folks who use artistic expression as part of their therapy, meaning in addition to talking with patients, they will also ask patients to engage in creative expression, whether it's through music or drawing, as part of the clinical treatment. So another thing that can be really hard when you're deciding to get into therapy is, oh my God, there are so many types of psychotherapy. So many of you have, if you've ever looked into therapy, even just like the slightest bit, you probably encountered this like acronym soup of different types of psychotherapy. And I want to just break down some of the most common types that you will encounter, which is, I think, extremely important in knowing which is going to be the right one for you. When people say, I went to therapy, it didn't help me, there's many reasons why that could be, but a very common one is that someone went into therapy with a particular approach that really wasn't suited to their specific challenges. So the first type of psychotherapy is what's called supportive psychotherapy. And you might think, oh, it's like getting emotional support. Sort of. The idea in this kind of psychotherapy is that the goal isn't necessarily to change you or the way that you think or your relationships. It's really meant to support the way that you think and feel and behave through whatever challenges that you're encountering at a particular moment in time. So, this is something that's often well suited to short-term psychotherapy. Another type of psychotherapy is what I would call exploratory psychotherapy. And this includes psychodynamic therapy and psychoanalysis. So exploratory therapy is aimed at trying to better understand yourself through your unconscious processes, your relationships, your history, your family, with the goal of trying to understand why you are the way that you are. So many of you may have heard of, Sigmund Freud and the history of psychoanalysis. Psychoanalysis is an intensive exploratory therapy. Classically, it takes place multiple times a week. And it has its own sort of historical legacies of how the therapists interact with patients. Psychodynamic therapy is the modern form of that. You don't have to lie down on a couch. You don't have to talk about your dreams, but the goal is to better understand where you are, where you came from, how it all fits together. When people think of therapy, like in the New Yorker cartoon of a person in a chair talking about their parents, this is that type of therapy. However, there's a number of different types of therapies that have a very different approach, and I would call them problem-solving or skills-based therapies. So just because you understand why you are the way that you are doesn't mean that you necessarily have the tools or the skills to change the things that you feel like you want to work on. So cognitive behavioral therapy, or CBT, is a type of therapy that evolved out of psychodynamic therapy that is aimed at helping people to be able to change the way that they think and behave and the way that they feel in order to tackle a given challenge. So a couple of the kinds of ways that CBT works is what's called cognitive restructuring. So this is identifying unhelpful ways of thinking and challenging those ways of thinking so that you don't get stuck in patterns of thoughts that lead you into unhelpful or upsetting ways of thinking and feeling. And then another way of the CBT works is working more in a concrete way on behavior change. So building habits, for example, or working on building a schedule that helps you, get out of the house and be productive and overcome depression, for example. And CBT has a number of really useful offshoots. CBT is a very broad category. One type of therapy I'm personally a big fan of is called acceptance and commitment therapy, or ACT. This is a therapy that the central philosophy is that trying to change the way that you think and feel is really hard. And what's more useful sometimes is to, in a mindful and non-judgmental way, acknowledge those thoughts and feelings and figure out ways of moving forward in a productive way. Dialectical behavioral therapy, or DBT, is one of, I think, the most important inventions in the modern mental health field. It is a form of CBT that was specifically developed for people with borderline personality disorder, who have struggles with intense emotional volatility and self-destructive behavior. But DBT is really helpful for many, many, many people. And what it's oriented towards is building skills for regulating emotional states, for managing frustration and anger, and for being able to navigate relationships in an effective way. So DBT is just like, it can be really life-changing for folks. And then mindfulness and mindfulness-based therapies encompasses a broad approach of being able to look at one's thoughts and feelings in a non-judgmental way, without immediately going into sort of knee-jerk spirals as a result of those thoughts and feelings. And mindfulness is used in all of the different CBT modalities, including ACT and DBT. There's a few specialized therapies I just want to briefly highlight. One is called EMDR, or eye movement desensitization and reprocessing. This is a highly specialized therapy specifically focused for people with PTSD, for trauma-related symptoms. It's not appropriate for everybody, but for those people who are trying to work through a very discrete and specific trauma, it can be potentially really helpful. And then something you may have heard of, because it's in the news a lot, is psychedelic-assisted psychotherapy. This is still an area of active research, but there is emerging evidence that, especially for people with histories of trauma, that the combination of particular psychedelic medications and psychotherapy can be particularly helpful. However, this isn't widely disseminated in the treatment landscape yet, because we're awaiting FDA approval on some of these, and it's still highly regulated and under research. Okay, so a big question I think that is useful to think about is, should I go to therapy or see a psychiatrist in person or via telehealth? So before COVID, telehealth treatment wasn't super common, and many providers refused to even offer it. Now it may sometimes feel like it's the opposite, where it's hard to find a provider that you will be willing to see people in person. There's advantages and disadvantages to each, and I think many providers use a hybrid model of offering both to patients depending on their particular needs. So meeting with a provider in person has certain advantages. One is privacy. If you want to talk about, your roommate or your romantic partner, being in a private office with a mental health provider is the most private option you've got. It's a separate space from your home or workplace, which psychologically can be really helpful, especially if you're talking about issues that feel very emotionally linked and intense to the particular location, like work or home. Another thing is that being in person requires you to commute to and from the office. And that is a double-edged sword. On the one hand, people are like, that's a pain in the butt having to commute. Many of my patients will say that their favorite part of therapy is commuting to and from it, because that's when they often have the opportunity to reflect on what they want to get out of therapy and the time to process what happened during the session. And so that's actually a very important consideration for some folks. And then the other thing is that when you're seeing a provider in person, it's an embodied experience. The provider can see your whole body, your body language, in the emotional intensity of connecting to a provider who you trust. Doing that in person is just a qualitatively different experience. Telehealth obviously has other advantages, the biggest being that it's very convenient. You have flexibility about the time and location of the appointment, but there's an important regulatory consideration, which is the way mental health works in the US, the provider has to be licensed in the location where the patient is located. So if you are in New York, and you're seeing someone via telehealth, that provider needs to be licensed in New York, even if they're seeing you virtually. Now, choosing a provider. What I want to walk you through is what the process at least should be like of how you choose a provider. Oh, someone is asking a question. You wanna jump in?
Yes, sorry. Thank you so much. Really quickly, in the scenario that you just described about locality, what
Yes.
happens when you're working with a provider on the regular? They are licensed in New York, you are residing in New York. What happens if you take, say, a teaching gig at a university out of country or somewhere else?
Yes. Oh my God, this is a huge issue that we've been encountering with creatives care because artists are often on tour or on location in different places. So during COVID, all of the regulations basically were temporarily suspended, and it was this free for all of providers seeing patients that were just like scattered all over the place. And then since COVID, a lot of these regulations have been getting put back in place. But the problem is that every state is doing a different thing. So like there's some states, like I think Arizona basically says any provider can see a patient anywhere, we don't care. And there are other places that are apparently more strict about it. And there's very little guidance. I mean, I can tell you as a provider myself, I'm really not sure what I'm supposed to be doing. My personal approach is that if a patient has a permanent residence in New York, that is where they live. I've seen them in New York and they are temporarily away for work or school or what have you. I will keep seeing them elsewhere virtually, but some providers are extremely paranoid and strict about this and will not do that. It also depends if the treatment is happening via insurance, because insurance providers can potentially be more strict about this. The point is it's an absolute mess. No one knows what they're supposed to be doing. And this is the mental health lobbying organizations are already working on this, where they're starting to create, for example, like multi-state licensing agreements. I mean, it's really wild. Like I have a patient who lives in Jersey City, and I have like now a New Jersey license so that I can see my patient virtually because she lives in New Jersey, like Jersey City. It's a really wild situation, and unfortunately, it's very confusing. But thank you. That's a great question. Okay, so choosing a provider. So let's say you have gone on the internet, you've searched on Psychology Today or what have you, and you have decided you have a couple providers that you'd like to reach out to. So what you're typically going to do, and certainly what you should ask for, is a phone consultation with the provider, and this should be free. Ideally. Maybe there's some providers out there that want to charge for this. I don't know who those people are. I think that this should be a complimentary consultation where you'll get to speak to a provider for 10, 15 minutes to let them know a little bit about you, to get a sense of their interpersonal style, and also logistical things like their level of experience, their schedule availability, their appointment fees, whether they accept insurance. And then once you actually select a provider, I want to highlight 4 attributes that I think are very important in assessing whether you are with the right therapist. So the first is trust. At the end of the day, you need to feel like you can be open and share what you need to share in therapy, that you trust the provider to be non-judgmental and to fundamentally care about your best interest. And if there isn't trust there, nothing in that treatment is going to work. That there simply cannot be an effective mental health treatment if there isn't trust between the patient and provider. And I would add that goes in the other direction. If you as a provider don't trust that your patient is able to be honest with you, that is a very limiting factor for the success of the treatment. The other thing is that you should feel that the provider is attentive to you, that they're actually listening and paying attention to what you have to say. I have heard some horror stories of people going to therapists, particularly online through some of those platforms that you see advertised on NPR or whatever. And the provider is like checking their phone in the middle of the appointment or checking their email. That's not cool. Like your provider should be paying attention to you and what you have to say. Also, you should feel like your provider understands your perspective, or is at the very least making an attempt to understand your perspective. If you are trying to communicate something to a provider and they are just not getting it, that's a real issue. I'll give you an example. I have a patient in my practice who feels that she previously had an eating disorder and was expressing to a prior therapist that she was concerned about her weight. And the provider started talking to her about various diet plans that she could go on. And my patient was very alarmed by this because she felt that the provider just fundamentally didn't understand her perspective, that it wasn't about, she didn't want to lose weight. She was concerned about having a history of an eating disorder. So if your provider is not even making an attempt to understand you, or there's a huge disconnect in that regard, that's a big problem. And then the last thing is, and I personally think this is extremely important, is transparency. I think that providers owe their patients transparency about what they're doing in the treatment and why. And if you feel like you are in a therapy and you don't know what's going on, you don't feel like the provider is being straightforward and honest with you, that's a really big problem. Now, this is something I think is extremely, extremely, extremely important. What you'll often hear out in society is you should feel comfortable with your therapist. Not necessarily, because therapy is really hard work. You should feel like you are going to be able to be comfortable with your provider. You should feel like you trust them, that you could get to a place of comfort. But if you feel uncomfortable being in therapy, that may be a reflection of the provider, but it also may be a reflection of the nature of therapy, that it takes time to get comfortable. What is critical, though, is that you should be able to talk about being uncomfortable in therapy. If you're uncomfortable and don't even feel comfortable talking about the fact that you're uncomfortable, that may be a sign that it's not the right provider. Now, this is unfortunately the biggest problem, and it sucks, and it's paying for treatment. So you have probably seen that many mental health providers, especially in New York, don't accept insurance. And you may wonder, what is wrong with these people, these greedy doctors? I thought they're all rich. Why don't they accept insurance? I have insurance. I don't understand. Here's the deal. The reason why a lot of mental health providers don't accept insurance is because the insurance companies pay providers really poorly for those services, especially Medicaid. And in a city with a high cost of living like in New York, a lot of mental health providers simply can't make a living just by seeing people through insurance alone. If they were to see people through insurance alone, the only way they can make it work is by having very short appointment times that simply are just not going to be effective for delivering high quality care. The other thing is that insurance doesn't reimburse for care coordination. So for example, let's say you're seeing a therapist and the therapist wants to call your psychiatrist just to chat about what's going on. No one gets paid for that, at least through insurance. And then the other thing is that insurance can be a massive administrative burden, especially for solo providers that are working independently in the community. Now, if you are looking into getting into treatment and you have insurance benefits, there are some big advantages to using those insurance benefits. And the big one is that it's potentially more affordable. However, there are also advantages to seeing a provider out of network or through, like, for example, cash pay, where you're just paying the provider a fee for service. One is that you may have more choices, especially for specialized care. And then the other thing is that you may be getting more attentive care from your provider, who's more able to communicate with you outside of session or coordinate with any other treatment providers that are involved in your care. Okay, so this is at least what I know about how insurance works. I have a medical degree. They don't teach you this stuff in medical school. Even when I'm looking through my own insurance plans, this stuff can be incredibly confusing. I honestly have no idea how anyone knows how to navigate the system without an advanced degree or like a background in accounting or something. But there's a few terms that you should be familiar with. One is deductible. This is how much do you need to pay before the insurance will start to cover your costs. The next is coinsurance. This is the percentage of the costs of treatment that you pay after meeting the deductible. The next is copay, which is a set fee that you pay per appointment. And this is only applicable to in-network treatment through insurance. And then it starts to get real messy. So one is called an allowed fee. This is the fee that the insurance company thinks is appropriate for a given billing code. So for out-of-network care, the insurance company will only reimburse up to the allowed fee. And I just have an editorial here for anyone who cares, which is insurance companies don't actually share their allowed fees in any of the marketing materials that they send you. You have to like actually get them on the phone and call them and ask what it is. So sometimes it's like the experience if you go see a doctor and then they send you this like EOB explanation of benefits and you're like, surprise, here's how much the insurance company says that they will cover. And it's just like, you know, playing roulette. Maybe one day this is going to start to get better, but right now it's very confusing. And then the last thing that actually you will know if you have an insurance plan is what's called the out-of-pocket maximum. This is the maximum amount of the amount of money that you pay out of pocket before the insurance company basically just starts covering everything. So because this is really confusing, we're going to go through a few examples of in-network and out-of-network treatment. But I first want to just walk through the like flow of how you pay for treatment using these different approaches. So let's say you have insurance and you find a provider who accepts your insurance. The way it works is your provider will submit a claim to your insurance company. The insurance will send you an explanation of benefits or EOB, and then you will be responsible for paying the deductible, the co-insurance and co-pays up to whatever, out-of-pocket maximum that you have, and it depends on your particular plan. Now, if you are using out-of-network benefits, which is only applicable if your plan offers them, many people do not even have out-of-network benefits, but if you have them, the way this process works is a little bit different. So what happens is your provider will send you an invoice and you will pay the provider's fee. You then submit the invoice to your insurance company. The insurance company sends you an EOB, and the insurance will pay you back a portion of what you paid, depending on all of these different factors, the allowed fee, your out-of-network deductible, the co-insurance, blah, 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 blah. And then the last thing that you, of course, can do is just pay in cash and just don't use insurance at all. And that's a very simple thing. Your provider charges you a fee and you pay it. Okay, so let's go through some examples. So the first example I'm going to give is an example of using insurance when you have good coverage. So let's say you have a plan that covers a lot of your care. It has a low deductible of $500. It has no co-insurance. It has a copay of $25 per session and an out-of-pocket maximum of $4,000. So let's say you decide to see a social worker for weekly psychotherapy. The insurance determines that the cost of your visit is $125 per session. This is that like sort of allowed fee of the insurance decides how much your session is worth. So what you do is you pay $125 for the first 4 visits before you hit your deductible. And then after the deductible, you pay $25 for each subsequent visit. And that's your copay. So if you see a therapist for 40 sessions in the year, what you're paying is $500 plus 25 times 36, or $1,400 over the course of the year. And that averages out to about $35 a session. Now, what if you want to see a provider through insurance and you have bad coverage? So let's say you have one of these high deductible plans. I call them disaster insurance because unless you're in a car accident and racking up massive, massive charges, the insurance isn't going to do a whole lot for you, but it's there to protect you in the event of an emergency when you need expensive care. So let's say you have one of these high deductible plans where your deductible is $6,000 and your co-insurance is 30% and your out-of-pocket maximum is, let's say, $10,000. So you're seeing a provider. The insurance says that the provider costs $125 a session. So you're paying $125 for every single visit. And the cost of 40 sessions is 125 times 40 or $5,000. Now, because you have not hit your deductible, you're on the hook for the whole thing. So you're paying $125 a session, and that becomes a lot more expensive. Now, if you don't see a provider through the insurance network, let's say you've got good out-of-network coverage. What I want to show you is that if you have good out-of-network coverage, you may actually be quite well off seeing a provider that's not in your insurance network. So let's say you have an out-of-network deductible of $2,400 and an out-of-network coinsurance of 30%. And an out-of-pocket maximum of $4,000. So let's say you decide to go see a fancy schmancy clinical psychologist who charges $300 per session. And you're like, whoa, $300 per session, that's expensive. Well, here's how it works. You pay $300 for the first 8 visits, and then you hit your deductible. And then afterwards, you actually only pay $90 per session because your coinsurance is 30% times that $300 fee. So you're paying $90 a session, and then you're actually only doing that for 18 sessions until you hit your out-of-pocket maximum. And so the cost of 40 sessions ends up being that out-of-pocket maximum of $4,000, which averages to $100 per session. So that's even cheaper than, for example, that previous example that I mentioned. And in this scenario, you get to see whatever, expensive, amazing provider that you want to see. Now, a couple things I just want to mention are things that can help make this more affordable, which is if you have an employer that offers a health savings plan or FSA, what this allows you to do is to set aside pre-tax money to be used on healthcare expenses. So what you will do is you will submit your invoice or explanation of benefits to the FSA to get reimbursed. There's some big downsides to this. One is that the FSA often has to be used up annually, and different plans have different policies about rolling over money across years. And the other thing is you often sign up for the FSA like in advance. So you have to know that you're gonna use it. So if you're in therapy for like several years and I'm gonna be in therapy all of next year, sign up for an FSA, you can use it. But maybe when you're first getting started, unless you know how much money you're going to be spending, doing this can be a little bit more confusing. Okay. This is really, really, really important. Insurance benefits reset annually. So I have a patient in my practice who I see through insurance. She just started a new job. She just got insurance. She's got a deductible of whatever amount. And the insurance kicked in September or October. And I asked her and I said, hey, so does your insurance, you just started it now? Do you have a year on it before the reset happens? Or is it going to reset in January at the start of the new fiscal year? And she's like, oh, I hadn't thought of that. And she called up, the insurance plan. It turns out that it would reset in January. So she started her insurance in September, was going to hit the deductible by December, and then it was going to reset in January anyways. And this is an absolute drag. So if you are thinking about going to therapy and using insurance benefits, one of the things to maybe be mindful of is if you do have a deductible, the time of year when you start therapy may matter, because the really crummy situation to be in is the one my patient is in, which is that she's going to spend several months meeting her deductible and then have to do it all over again. So that's a really unfortunate thing that can happen. So yes, the system sucks. It's confusing. It's terrible. I don't know how anyone navigates it. And I'm a doctor. I don't understand it myself. So now I want to talk about this organization that I co-founded that aims to help artists access mental health care, because my feeling is that this system is really confusing, especially if you're an artist and you're not necessarily experienced or comfortable with healthcare systems. This may be really intimidating and a barrier to getting into treatment. And so what we want to do is figure out how to make it easier for artists to find care if they're looking for it. So Creatives Care is an organization that I co-founded a couple of years ago. And our philosophy is that we want to secure the future of the arts by helping artists access affordable, high quality mental health care. So here's what we do. We offer what's called patient navigation services. So we will give free guidance to artists who are navigating the mental health landscape. An artist will reach out on our website, give some just very basic info, contact info, and we will give, shoot the artist an email and set up a 15-20-minute phone call with the artist, completely confidential, to get a sense of their mental health needs, their background, their financial and insurance info, and what they're looking for in treatment. And then what we do is, based on their particular needs, try to connect artists with appropriate referral options, either using existing resources that exist in New York City or with a referral network that we've built of providers who have a particular interest in working with artists and are willing to see artists at reduced rates or through insurance. And we've built a really diverse background of providers with different types of clinical training, different sets of expertise, different lived experience. And so we've had great success helping find the kinds of providers that artists want to work with. And then the last thing that we are getting ready to launch in the next couple of months is a financial assistance program, which is that for a very small subset of the artists who we work with, who really are unable to afford any kind of treatment, we are looking to help subsidize the cost of that treatment so that anyone who wants care should be able to get it. So we support artists across the visual, performing, and literary arts. One thing is that because of this licensing issue, we do require that the artists have a residence in New York. We've had artists who do tour or have temporary placements elsewhere. That's fine, but as long as there's sort of a permanent residence in New York, that's sufficient. And then we also, just because unfortunately we can't serve every single person we would like to, we require that artists are engaged in creative work for its own sake. Having a day job is fine and expected, but we do want the artists that we're serving to be people who are doing some type of creative work. And there's a range of people who reach out to us. It includes instrumentalists, vocalists, composers and songwriters, dancers and choreographers, visual artists, actors, directors and theater designers, playwrights, screenwriters, filmmakers, and also creative writers, people who are writing literature and poetry. So one of the things that we do is we work to build community and raise awareness by hosting events. This was an event in September where a filmmaker did a screening of a film that she made specifically about the intersection of art and memory. We have panel discussions with bringing mental health providers and artists in communication with each other to foster greater understanding and collaboration between our disciplines. And there are ways that artists can get involved. So obviously, if you want help finding mental health treatment, reach out to us. We don't ask anything of the artists who reach out to us for treatment. There's no fee for accessing our services, and we certainly don't require anyone to do anything afterwards as a result of having received treatment. And of course, as I mentioned, everything is completely confidential. However, there are artists who are really passionate about what we do and they want to get involved. So we ask people to spread the word, tell your friends and colleagues about what we do, post about us on social media, put up a flyer in your dance studio or in your rehearsal space. There are artists who want to perform at our events or showcase their work at our events. And that helps us raise awareness. And then for artists who have a real commitment to advocacy about mental health and have a strong social media presence, we have an artist ambassador program for artists who want to really be involved in directing our organization's strategy and helping us to grow and expand our presence in the artistic community. So that's what I wanted to talk about today. I've included some links here to our website. We have Facebook and Instagram pages as well. I would add that we're actually in the process of updating our website in preparation for what will hopefully be our first big official press release. So if you see our website and it looks a little clunky, just hang in there. It's going to get better in a couple of weeks. And also, you can always email me directly or any of our team members. And like I said, if you're specifically interested in getting treatment on our website, there is a tab called Find Care, and that's where you'll input the form in order to speak with one of our team members. So that's everything that I prepared. And wow, that was exactly 1 hour. Awesome. So that gives us a little bit of time for questions, discussions, feedback, comments, criticism. I'd love to hear what all of you guys have to say. I'd love to hear if you've had experiences navigating mental health that you're open to share, or friends of yours, their experiences, or just the general state of mental health in the arts. I'd love to hear what you guys have to say. So thank you so much.
Thank you, Alana. I mean, myself personally, I feel like I've just learned so much, and I really appreciate how transparent you are and acknowledging, I think, something that we have all felt, which is just how difficult it can be to seek this kind of care and navigating it in insurance and all of that stuff. I see that Alberto put a question in the chat, which was in that umbrella of artists that are eligible for creatives care, are burlesque artists included in that?
I don't see why not. It's dance. I would think. Yeah, we're pretty chill. Like, we're a mental health nonprofit. We don't want to turn anybody away. So we've had people reach out to us who have more offbeat or interdisciplinary types of artistic or creative work. And like, I'll give you an example. We had someone reach out to us who was a personal stylist, and that's not part of our wheelhouse, but we didn't have the heart to say, no, we're not going to help you. We have to find a therapist. I mean, like, we're therapists. We love this stuff. We did say no to a couple people who reached out to us who were administrators for a record company, and was just like, we're so sorry, but here's this other resource that really is well suited to you. We never just say to anyone, like, go away. At the very least, we're going to point you to another organization that does something similar to us that is better suited to help you. But yeah, who are we to say what counts as art and what doesn't?
I appreciate that. Thank you so much. While I work regularly in the theater and dance world, I also moonlight in cabaret and nightlife and in burlesque. And I feel like those forms oftentimes are cast aside or treated, less than, or they're not afforded the same opportunities. And so it's really helpful. I'm happy to take back to that community about creatives care, especially I feel like that community often it could be put to very good use there.
Yeah, I really appreciated this talk today. I really appreciated all the talks thus far, but this one particularly felt catered to the idea of like our lifestyle, which seems to be something that's always hard to translate in session. Like, I've had really great therapists. I had, when there was the horror story about the person on the phone, I remember, I think I had a licensed social worker, and you could just tell that this person had like a lot of cases throughout the day, and I was the end of the day, and it was just not the moment. But luckily fortunately, I had been going to this particular provider for a while that did accept Medicaid when I had it. But the issue was like constant turnover and people coming in and out, and then having to reacclimate yourself. So
yes.
It's like doing the work all over again. I'm hopeful and excited because I know like that whole bad coverage is all I'm being offered right now. So it's just like, hopefully there are options. And I have all the fellow artists that I work with, like one is covered through like the Grammys, and another is covered like because they teach at a college and then they get half insurance. And I'm just like, I really don't know where to start. So this feels like a good place to begin.
That's what we want to help with. And we're very mindful of those specific challenges. Like, there's this attitude that like beggars can't be choosers. And if you have Medicaid, like you should just be grateful anyone accepts it. And there are training clinics in New York that offer very low fee treatment or accept Medicaid. And the sort of like flip side of that is that you're with a therapist in training who maybe every couple of years is going to turn over. And for some folks, that's fine. Maybe even something that they actually like of getting to work with different types of providers. But for some folks, and this is especially true for people who have any kind of trauma in their background or a history of difficulties with attachment and relationships, the thought of getting close to a provider only to then lose them is absolutely terrifying. And people would rather not be in treatment than have that experience of getting close to someone and losing them. And so that's definitely something we're really mindful of, and try as much as possible to be able to talk with artists about and help them navigate that as well.
Thank you so much. Oh, I just thought of another thing. I don't want to monopolize the time, but a lot of people, like when I was first losing coverage, a lot of people talked about like how sliding scale works. Do you have any insights about that?
Oh, absolutely. It's just at the whim of the provider. There's no like organized, coherent system for how this works. There's many different types of provider strategies for doing this. Most mental health providers are ethical, good people who really want to help their patients. And so most providers will say, hey, I really want to work with you, or I'm already working with you and you're running into some financial hardship. Let me try to figure out a fee that's going to work for you, either for a longer period of time or temporarily while you're going through this hardship. There are some providers out there that don't do that. And they're just like, this is my fee. If you can't pay it, go find somebody else. I think most mental health providers don't do that, like, because it just feels crummy. What some providers do, and this is what I do in my own practice, is I do this sort of hybrid model where I call it, I don't know if this is like un-PC or whatever. I call it a Robin Hood model, which is like, I have patients that like work in finance and stuff, and they pay like a higher fee. And then I reserve space in my practice to see artists and students, or people who are going through financial hardship. And for those folks, I'll see them through insurance using a platform called Headway, or a reduced fee, or waiving a fee as necessary. And I think it's extremely unfortunate that the burden falls on mental health providers to make mental health care access more equitable. It should not fall on us to correct the injustices in our mental health system, that some people are more able to access care than others. But unfortunately, that is the system we are navigating. And thankfully, there are a lot of mental health providers that will do this. They will often not advertise it because they don't want to be inundated by people in need, because so many people are unfortunately in need. That's one of the things that we felt was going to work about Creatives Care, is because we have this network of providers. We can go to them and say, hey, here's this really compelling artist. This is how much they can afford for therapy. Who's got availability? Who's got space in their practice? And that way we can go to the artist and say, hey, here are 5 different therapists that are really excited to work with you and can meet the fee that you are comfortable paying. And that's hopefully less threatening than you just cold emailing a bunch of therapists being like, I know your website says that you charge this amount, but I can only pay this amount. Like, can you take me, please, please, please? So we really want to avoid that, because it's, these are, again, reasons why people just say, to hell with it, I'm not going to go to therapy.
Thank you.
I see Alberto's hand is up.
Someone is posting about an organization called Sea of Visibility. I would love, would you mind telling me about that? I've never heard of you guys.
It was started in 2019, just a year before the pandemic. Why don't I can speak after Alberto? I think his hand was up before I wrote that.
Oh, it's
It's
okay.
okay.
Why don't you finish up first?
Oh, okay. Sea of Visibility, we did that. It was based on my personal voyage as an artist, and disclosing finally to my community. And it was kind of a risk of it was before it became a topic that was so in the news and all of that, and so much was coming out. And it was basically he's going to see if people connected with me or if they were going to, you know, disregard me because it's very much stigmatized to have a mental illness, or maybe it's not so much anymore. I don't know. I spent 25 years with it extremely stigmatized and not being able to talk about it, which was, of course, made the illness like that much harder to work with. But because of that, we gathered more and more people who were willing to come out about it. And that was in 2018. In 2019, a group formed of various artists who wanted to talk about it and be comfortable with themselves and be out about their mental illness. And we are looking for resources to help us. And
Oh my God, I
seems to
love
be
this.
matchmaking us.
Yes. Yes, yes, yes. I love this. I just want to say that a lot of the artists that have reached out to Creatives Care identify as people of color or in the
Yes.
queer community.
We're
No
marginal.
surprise there. And we have a lot of providers that hold those identities. And we've had artists what will say, it's really important for me to find an Asian American provider, or it's really important for me to have a queer or queer affirming provider. We got it. Like we can hand, like we've worked really hard to be reaching out to providers from many different backgrounds, and like so far have had great success in helping artists find providers that are affirming their identities.
Did you see the mission statement by any
I
chance?
did.
Oh,
I'm like,
that's why you saw it. Yeah.
we gotta
And
talk.
within
This is
BIPOC, it's
incredible.
more marginalized because our it's like it has a different layer of a stigma and tradition and what we have to fight against to come out. And also being queer, like that tends to like almost across race, you know, ostracize people from families and family support and all of this complexity that we've discovered that
Absolutely. We've had artists who've reached out to us who want providers who are kink affirming, poly affirming, all sorts of things affirming. And like I said, therapists are awesome people. We love working with people from different backgrounds. Pretty much everyone's affirming because like we're shrinks and we're a bunch of hippies. So this is fantastic. And I would love to talk about this more.
Thank you.
Yay for hippies.
Yeah, I mean, I'm not a hippie. I'm like an Upper West Side like psychiatrist, but
Well, I had two real quick things. I know that we're pressed for time. One was I just wanted to check and ask, similar to one of my boss Courtney, who's been to a couple of these. I wanted to ask, would it be possible to request your deck? Is that possible that we could your slide deck?
Oh, this slide deck?
Yeah, it's filled with
Totally.
really great comprehensive information that's dissectable. And Hasim, who had to leave earlier, he and I are on a group at the New Victory that is disseminating information on behalf of the entire ensemble. So it's just like we're acting as ambassadors, which is really helpful.
100%. And another thing that we can do is we also can just like give this seminar to your organizations. We're starting to do this. So we've set up, for example, like we're going to give this same kind of presentation to the Mark Morris Dance Group later this spring. This is the kind of outreach work we want to do, especially if it can be in person, because we want to get to know the community. We want to hear feedback from artists about how to improve our services. One of the things that we're actually currently in talks about getting started is peer support groups. And we just really want to know from artists of what their biggest concerns are, and how to continue to grow as an organization. Because, you know, the reason we started this is that frankly, no one else was doing it. So it's very much a grassroots bottom up effort, and it's very much driven by artist involvement and feedback.
The second really short thing I wanted to offer was actually in response to what Alexis was raising, which was really briefly, I just wanted to share, like I began my I guess mental therapy journey 20 years ago as a budding dancer in the community, not having insurance and struggling with a relationship that had fallen apart and not having any emotional tools. And I was fortunate. There wasn't like at that time, there didn't exist a Creatives Care. So for me, fortunately, there was a friend who recommended someone else, and that therapist did in fact afford me a great sliding scale. They completely understood who I was, where I was coming from, and afforded me that. And I will say, to their credit, I'm grateful. Over the years, they were able to successfully increase what my fee would be because I was getting better, and I could, my life was improving to meet that. And that was actually doing me a solid to teach me to be like, hey, this is something I can pay for and I can do. So that journey exists and that's real, but I can only imagine how different it would be had there been a creative's care available at the time, something that wouldn't have just that was already present and there. It's kind of be that go-between to introduce me to a person like that. I feel fortunate that I had people in my life who could introduce me to that, but I know not everyone has that immediately.
Yeah,
So I
especially people
really
who are
believe
new
what
to New
you're
York.
offering. Yeah, absolutely. Especially if you just landed. I mean,
Mm-hmm.
it's just not this, it's not always available through the immediate relationships you may or may not have. So
Yeah.
knowing that there's some place you can go to where someone like yourself or your organization could be like, you know what, Alberto, Alexis, we see you. We think these are some individuals we can introduce you to who can understand that. That's
Yeah,
just
it's
fantastic.
more yeah, and like I want to also just say like what we do is we don't just like it's not like you email us and we're just like, hey, here's a list of like cool therapists, go reach out to them. We talk to the artists and just the experience of feeling like you have someone on the phone who's listening to you and like cares about what you're going through is I think itself therapeutic. So that's what we do. And thank you so much for sharing that. Like, we're working so hard to get this organization like now it's really off the ground, but scaling it so that we can serve more artists in New York and hopefully in other cities as well. And I'm so grateful that you guys feel like this is something that's really going to be benefiting the artist community. Oh, I see someone say we're yentas of therapy. A yenta, I got to say this because I'm Jewish. A yenta is somebody who's like a gossip. The term in the Jewish world would be a shadchan or matchmaker. That's what we're doing.
Thank you so much. That could you say it one more time? What is the term?
Shadchan?
Yes,
We're not
that's
actually,
what it is.
we're actually not matchmaking because we're not we think that artists know what's best for them. We are not going to tell you here's who you should go see. We're going to curate a list of referral ideas that we hope will be helpful and then leave it to the artist to decide for themselves who they want to go see because there's no way to predict what kind of therapist is going to be the right one for you or the right fit. It's weird animal spirits kind of stuff. So we like as much as possible to give artists multiple referral options so that they can then think and decide for themselves what's going to be best for them. Unfortunately, sometimes none of those options may be ideal, and we try as much as possible to work with artists to find some sort of solution. Yep.
We may have some social workers in our group that would be interested in talking with you and
yes,
part of your mission too.
Absolutely. So on our website as well, and maybe I should just show our website, even though it's still like not entirely under construction, but we're going to hire a web designer in like the next few weeks. So here's our website. And what is this allowing me? Hold on. If you can see, there's different tabs. So find care is we need to like clean up the pictures. So basically, if you want to get into treatment, this is like a little form that you can fill out, just saying like, here's my contact info, here's what kind of artist I am. We'll then reach out to you to schedule a consultation. And then for providers, if you want to join the network, we have a more detailed form getting a sense of your professional training, your licensing, your professional background, what kind of specializations and treatment modalities that you work with. We are moving towards interviewing the providers in our network so that we really know everyone on a personal basis so we can make the best possible referrals. But if you know social workers who want to join our network, they can just fill out this form and then they'll start getting the emails that we send out about potential referrals. And they're more sort of also another thing to look at. Again, we really need a web designer. We built this ourselves because this is grassroots. We have a resource page with really extensive options of different organizations that cater to artists, where you can get low fee therapy, where you can get it through. I mean, this thing is massive. Lots of different options with descriptions so that you can try to find options that may work for you. However, we recognize there's so many resources. That's why we are here is, if you don't want to deal with this, you just talk to us and then we'll say, oh, hey, maybe you should reach out to the National Institute for Psychotherapy. They offer reduced fee treatment. They're in your neighborhood. That would be a great option. So, this is for perusing, but we're there to support people who are wanting to look through it.
Anybody have any last questions as we're getting close to the end of our time here together, which has been so lovely, I have to say.
Fantastic. So Kinsey, if you can, maybe what we can do is send out an email to participants. I'm happy to share our slide deck. I'm also very happy to have anyone email me personally. If you want to get into treatment, the best way to do it through our form on our website. If you just want to email me to chat, you want to get involved, you want me to, or one of our people in our organization to come meet with your artistic organization, reach out to us. Our goal is to really get to know the artistic community in New York and all of the organizations that support it, including the Arts Roundtable. So thank you. And I want to thank, if Macy is still on the line, Macy Sullivan is a volunteer in our organization who is a dancer and teaching artist. She joined us as a volunteer and has done just incredible work connecting us to arts institutions in the city, including you guys. So I just wanted to thank Macy, and that highlights why it's so important for us to have artists who are involved with the organization who can make sure we're meeting the needs of the creative community.
Yes, I want to second that. Thank you, Macy. Macy is the one that reached out to the roundtable and got this ball rolling. So grateful for that. And so grateful for you all. Thank you so much for joining us today. And thank you, Alana, for spending this time with us. I feel like you went through so much extensive information and it made it a little bit less scary, which I love and appreciate. And then just having this open space at the end to talk through things has been just excellent. So thank you so much for your time. Folks, I did put Alana's email at Creatives Care in the chat. If you want to directly email her, you can. That will be included in the resource follow-up email, along with recordings and the slide deck. I will get that from Alana as well, and any other links and things that we have shared the entire week. So look for that email from me. And I will turn these last 6 minutes back over to you all. Thanks for joining us. Oh, I should remind you that we're not done yet. We have 2 more sessions for this series. So we are meeting here again tomorrow, same time, same place, 4 to 5:30 p.m. for our next session, which is called Every Teaching Artist Insured, Understanding Your Healthcare Options. This is going to be with Renata from Entertainment Community Fund, who's going to walk us through all of your most affordable healthcare options if you live in New York. So I know in our last 2 sessions, we've had some more nitty-gritty questions come up that we haven't quite covered yet. This will be the time to be asking them. So we hope you can join us then, but it will be recorded as well. And everyone have a lovely rest of your evening, and I hope to see you tomorrow. Thanks all.